Planning for a pandemic, an overview. Outbreaks of infectious diseases can easily transcend borders, posing an array of challenges at local, regional, and global levels. A pandemic can have a major impact on all facets of the global economy, ranging from travel, trade, tourism, food consumption, and ultimately investments and financial markets. Looking back, the H1N1 outbreak of 2009 served as a wake-up call for many organizations. Across the world, business operations were interrupted in the face of an unfolding, international health crisis. Even businesses that had continuity plans in place largely found they were not robust enough to protect workers and secure ongoing business operations. Why is planning for a pandemic different from planning for other emergencies? Preparing for a global pandemic is different than preparing for other emergencies or natural disasters, like fires, earthquakes, or riots. A public health emergency such as a pandemic is not focused on infrastructure, nor is it a discrete, isolated incident. A pandemic will simultaneously affect multiple areas of the United States and other countries as well. Furthermore, a pandemic will likely be an extended event. Multiple waves of the outbreak may occur in the same area, each lasting for 6 to 8 weeks over a period of a year or more. It is also important to note that the pattern of disease during a pandemic may be different than a seasonal outbreak of an infectious disease, such as influenza. Pandemics are not season-specific. With all the uncertainty a pandemic brings, businesses and industries must develop contingency plans that are flexible and can adapt to rapidly changing conditions. To plan for an infectious disease outbreak, one must consider human factors like employee hygiene, sick leave policies, and absenteeism, in addition to operational considerations, such as supply chain disruptions and possible interruption of essential business operations. When planning for a pandemic, organizations should look to the World Health Organization's 6-phase pandemic tracking model as a guide. Phases 1 to 3 of the model encompass a time period when animal-to-human transmission of a virus has been documented, but human-to-human transmission sufficient to sustain community-level outbreaks has not been documented. During these 3 phases, businesses should develop infectious disease preparedness and response plans, test those plans with tabletop exercises and site-level drills, and update plans as needed. Phase 4 is when human-to-human transmission of the virus has been verified at levels high enough to sustain community-level outbreaks in a single area. During this phase, businesses need to implement their preparedness and response plans. Phase 5 is when sustained, community-level outbreaks in at least 2 countries in a single WHO region have been documented. The last phase, Phase 6, is when community-level outbreaks spread to at least 1 other country in a different WHO region. By Phase 5 and 6, it is too late to start planning for a pandemic. Instead, it is time to execute strategies needed to minimize the impact of the outbreak on the business, the community, and the economy. The COVID-19 pandemic is not the first global health crisis, nor will it be the last. While COVID-19 has exposed significant gaps in business preparedness around the world, it has also presented the opportunity to address those shortcomings and learn, improve, and develop business continuity plans that will help businesses successfully weather the next pandemic. Successful organizations must be at the forefront of change to position themselves for long-term success. Now is the time to embrace the inevitability of change, invest in digital solutions, reassess organizational structures and practices, and consider process automation to improve efficiency.